I declare open the Legislative Assembly Legal and Social Issues public hearing for the inquiry into support for older Victorians from migrant and refugee backgrounds.
The COVID-19 pandemic has demonstrated the stark inequities and gaps in public health policies, systems and services.
When we conduct community legal education for elder communities, the lack of translated resources is a problem that comes up all the time.
We believe that there should be a bit more data. There should be a bit more consideration about the experiences of the community.
We need flexible and adaptive services that meet the unique cultural, spiritual, language and lifestyle needs of older people and their families.
The local government sector recognises the need for greater state government support, not only to councils but also to community groups and organisations.
Would you consider, from what you've said and from the other written evidence, that most councils would perceive that the state government has underfunded this area in terms of supporting them in their programs?
I'm not sure whether they'd put it as, maybe they would express it as underfunded, but I think there's, local government has many financial pressures that they're facing at the moment.
Do you see that there is almost a disconnect between local government and the local multicultural or ethnic communities councils?
There's variation across the state, obviously, but I think those groups work really well, and I think councils are really keen to work in a partnership with whatever community groups they can to achieve the best results for their communities.
Yeah, I agree, but I do know of situations where that doesn't happen.
With 79 councils, something is sure to happen. So we just hope that is something that can be changed and improved over time.
I'm particularly interested in the Victoria Police trial regarding elder abuse. Can you just tell us a little bit more about that?
This trial brings together many of the key stakeholders required in a collaborative model, including police, health, legal, local government and financial institutions. And we've actually had an issue where the bank has actually referred a client to us where they've identified suspicious transactions and they've referred it to us. So we certainly think that the banks are a key player in moving forward in identifying early intervention of elder abuse.
How can the Victorian State Government and councils improve the capacity of the workforce to provide culturally inclusive and trauma-informed care?
So flexibility around the ways in which we implement programs, and that comes from understanding the issues experienced by the cohorts for whom we serve.
Having a workforce that's reflective of the community will better enable that cultural awareness, nuances and understanding within the organisation itself, but also some cultural competency training for the workforce.
In your written submission, you talked about the importance of the family.
The structure of the family has changed. So traditionally you would have women staying at home, grandmothers, aunties, very close-knit families. Today, most members of the family have to work, and therefore some of those supports that were home support, if you like, are disappearing. I think this is a very, very important point. So family, yes, by all means, is still central to our society. However, we shouldn't expect them to do services that the government should be providing.